Hello, good afternoon, muy buenas tardes tengan todos ustedes, queridísimos radio escuchas de Voz Tacoma Radio Universal y nuestras estaciones afiliadas en donde se va a estar escuchando este programa en los días que vienen, tanto la KTQA 95.3 FM de corto alcance aquí en la ciudad del destino, Tacoma, Washington, y también en nuestra estación, la KQWZ 106.5 FM allá en el sur del condado de King, específicamente en la ciudad de Des Moines. Aquí también un saludo muy especial a quienes nos van a estar haciendo favor de sintonizar o de más bien de conectarse a través de nuestra plataforma en YouTube como BTRU y en Facebook como BT Radio Universal. Muy buenas tardes, tenemos ya aquí la presencia de nuestro invitado, el congresista Derek Kilmer, que él representa el distrito número 6 del estado de Washington. Tenemos 10 distritos aquí en el estado de Washington y él es representante de uno con pues una gran extensión de territorio. Así que vamos a comenzar esta entrevista. Tenemos también a nuestras invitadas pues van a ser quienes van a estar a cargo de hacer las preguntas. Tenemos primero a la profesora Anaid Llerena. Ella es profesora auxiliar en la Universidad de Washington, aquí en UW, aquí en Tacoma. Y también pues ella la hemos invitado porque ella pues ha estado pues muy activa en todo lo que se refiere a... Hay muchos aspectos en la comunidad, ¿no? Que tiene que ver mucho con el impacto económico, y como esta entrevista la estamos haciendo, este acercamiento que estamos haciendo es con enfoque a la comunidad Latinx, por favor, más adelante esperen, vamos a estar volviendo a reproducir esta entrevista totalmente en español, pero hoy que estamos haciéndola en vivo, vamos a hacerla para que tenga más fluidez. En inglés vamos a hacer las preguntas en español y de esa manera vamos a conducir. Así que también tenemos vía StreamYard a Maru Mura. Maru es la directora, la creadora de la... Corrígeme si estoy en un error, Maru, pero la fundadora de la organización La Resistencia, pues una organización local, ¿verdad? Con base aquí en el condado de Pierce, que ha estado luchando de verdad por mejorar las condiciones de las personas que están detenidas en el centro de detenciones aquí del noroeste, que está en Tacoma, pero más allá de eso, por que el sistema de migración pues finalmente pueda resolverse todas las fallas que tiene, pero bueno, más adelante vamos a explicar un poquito más de eso. Y también tenemos a Jasmine Ford aquí con nosotros en el estudio. Jasmine ya la conocen, ella es conductora del espacio Siembra los domingos a las 9:30 de la mañana, y también tenemos algunas preguntas hechas por el doctor Enrique León. Él también es pues un miembro de la comunidad muy conocido, trabaja para Multicare como doctor, pero es profesor auxiliar en la Universidad de Washington, también aquí en el campus de Tacoma. Así que vamos a comenzar por darle la bienvenida a todos ustedes. Muy buena tarde, bienvenidos aquí a su espacio Voz Tacoma Radio Universal. Así que adelante, los tenemos ya en cuadro. Muy buenas tardes a todos. Good afternoon, Congressman Kilmer. Welcome to Voz Tacoma Radio Universal. And how's everybody on that other side of the studio?
We're good. We hear you just fine.
Excellent. Okay, well, I was saying in Spanish really quick, so welcome to BT Radio Universal, and greetings to all the listeners that are going to be also listening to this an interview through our radio stations, KTQA 95.3 in Tacoma and also 106.5 Low Power FM in South King County. Welcome, everybody. So let's start with Professor Anaid. Anaid, if you can please tell us what you think are the topics we should address in this interview now that we have here Congressman Kilmer on the economic impact that it's for especially for our community, for our Latinx community. And
Sounds good. Thank you so much, Christian. Happy to be here. Thank you for joining us, Congressman Kilmer. And I'll start by asking the question in English, and then I'll translate it into Spanish. So my first question for you is, what are you doing to make economic empowerment strategies anti-racist? y le di la bienvenida al congresista Kilmer y aproveché para hacerle la primera de mis dos preguntas, que es ¿qué está haciendo el congresista para que para que estrategias de empoderamiento económico sean antirracistas?
Yeah, so for me, it's important that we combat racism in every form. And so a lot of the legislation that I've sponsored has been focused on addressing racism when it comes to and ensuring that there's equitable outcomes with regard to our healthcare system, with regard to housing, with regard to educational opportunity, with regard to things like nutrition access. And as you point out in your question, working to ensure that people have opportunity economically, regardless of their country of origin, the color of their skin, or anything else. One of the important things that happened during the pandemic was a recognition early on that outcomes were different. You saw programs like the Paycheck Protection Program, which was targeted at helping small businesses. At the beginning of the pandemic, there was a wide disparity in terms of who took up that program. Minority-owned businesses, people of color were far less likely to benefit from those programs. And so Congress passed an update to that bill that focused specifically on driving resources to communities of color. It was a $60 billion investment specifically trying to support minority-owned businesses and to have equitable access to those relief programs. That was really important. Second, you've seen action out of the House for a bill called the Racial Equity, Inclusion, and Economic Justice Act. And that's really trying to get at promoting racial and economic justice through the financial services sector to prevent discrimination when it comes to access to capital, prohibit any sort of lending discrimination, looking at and trying to address some of the racial and ethnic disparities when it comes to employment and income and wealth, and also improving access to capital through community development financial institutions and through minority depository institutions, which are generally far more focused on supporting communities of color. So that set is all focused on sort of access to capital. Second, there's an effort to acknowledge that we also have to look at, just from a regulatory standpoint, making sure that people are treated equitably. It is a problem in our country when an African-American woman gets paid 64 cents on the dollar as a white man. Mm-hmm. And there's a bill to address that I am a sponsor of called the Paycheck Fairness Act, which embraces what I think of as a pretty simple principle of equal pay for equal work. That has passed the House. That is unfortunately not unlike the other bills that I mentioned, the financial services bill tied up in the Senate, the Paycheck Fairness Act tied up in the Senate. A bill that has become law is a bill that I was the lead sponsor of called the Recompete Act. It tries to focus some additional resources and support to communities that have faced persistent economic distress. And as you overlay the economic challenges with some of the demographic information, communities of color are unfortunately more likely to be suffering from persistent economic distress. So the bill that I sponsored got included in the CHIPS and Science Act, and it focuses on providing some flexible, long-term economic assistance to those communities to try to help lift them up and to try to provide more employment opportunity, more economic opportunity, so that regardless of the color of your skin, regardless of your country of origin, regardless of what zip code you live in, that you have a shot, that you have economic opportunity.
Thank you. I appreciate the multi-pronged approach, and then, yes, hoping that things that make their way through Congress then keep going and moving up the chain.
You bet.
Entonces, le agradecí al congresista por su respuesta y por reconocer que estos son problemas y soluciones que necesitan varias avenidas y también esperanzada de que eventualmente algunas de las propuestas de ley que él que la ha escrito y que apoya, que pasen en el Senado, porque algunas de las que nos mencionó aún siguen, pasaron en el Congreso, pero no han sido aprobadas por el Senado. My next question is based on a recent story from the New York Times stating that the International Monetary Fund said that the world economy is headed for stormy waters as it downgraded its global growth projections for next year and warned of harsh worldwide recession if policymakers mishandled the fight against inflation. And so my question to you is, how are you working to address inflation along with your colleagues at Congress? Entonces, la segunda pregunta que le estoy haciendo al congresista Kilmer está basada en un reporte de la semana pasada del periódico El New York Times, en el que se mencionó que el Fondo Monetario Internacional reconoce que la economía mundial va encaminada a momentos tormentosos al haber bajado de nivel o las proyecciones globales de crecimiento que había para el año pasado. Y esto tiene una muy alta probabilidad de crear una recesión mundial si nuestros congresistas y la gente que decide las políticas a nivel nacional no manejan bien la lucha en contra de la inflación. Entonces, mi pregunta para el congresista es, ¿qué están haciendo en el Congreso y él en particular para manejar la inflación que estamos sintiendo todos?
So it's a problem when the people I represent can't afford the things they need. Mm-hmm. And so the inflation that we've seen, not just in our country, but all over the world, mm-hmm. is certainly a problem, because it means that a lot of families are sitting at their kitchen tables saying, okay, what are we not going to buy? Because the costs of the things we need have gone up. I wish I could tell you there was a silver bullet to addressing that. I think it's more like silver buckshot. There's a bunch of stuff that we need to do. Mm-hmm. There have been two main drivers of the problem. One is the Russian invasion of Ukraine has had a very substantial increase in gas prices. The second is the pandemic, which was very disruptive to supply chains. And in an economy where when there is a shortage of supply and demand has gone up, prices go up. Mm-hmm. So what do we do about it? So let's break it down by topic. Let's start with gas prices. Mm-hmm. I'm very conscious of the increased price at the pump, since my district goes from Tacoma to Nia Bay to Ocean Shores, and you know, the people I represent are definitely feeling the pain of that too. Congress is actually, you've seen some action out of the administration, increasing the supply out of the petroleum reserves. That's what they're there for, and that thankfully has had some positive impact just from a supply-demand standpoint. Congress recently passed a law called the Inflation Reduction Act that was signed by the president. And one of the components of that was trying to reduce our dependence on fossil fuels so that over time, we're able to see reduction in energy prices, not just at the pump, but else, within our homes mm-hmm. as well, home heating and appliances and all of those sorts of things. If we're able to have greater energy efficiency, if we're able to be less dependent on fossil fuels, it means that we're less vulnerable to Vladimir Putin or anybody mm-hmm. else putting us over the barrel, literally. The third thing, the House has passed a bill that has not yet passed the Senate that goes after oil and gas companies for price gouging. If you look at the last now 3 quarters, the oil and gas companies have booked record profits, which means they're making money on our backs. And I don't think that's fair, and I don't think that's right. And so the House has passed a bill that says let's empower the Federal Trade Commission to have more regulatory authority to go after price gouging. Mm-hmm. I think that makes sense, and it's important that we protect consumers. So that's the kind of gasoline piece of this. Let's talk a little bit about supply chain and some of the costs that have gone up for that. Let's just use one area of examples, and that is automobiles, appliances, personal computers. Those have all gone up in price. And it's primarily because of a shortage of microchips, of semiconductors. Amazingly, the United States actually invented the chip, but now we only manufacture about 10% of them. And as a consequence, when there has been disruptions in the supply chain, when there's been disruptions in manufacturing, in other parts of the world, we can't get chips. So if you go to one of your local auto dealers, you'll notice that there's something missing on their cars, right? Like there's a shortage. And that's not because we stopped making cars. It's because we don't have chips to put into cars. And so the House and Senate passed a bill that has been signed by President Biden into law called the CHIPS and Science Act. And it really is focused on trying to bring those jobs back to America and make sure that we're not facing these shortages. Now, that's not going to fix things overnight, but over the long haul, I think that's going to be really important, both from the standpoint of domestic economic growth and in terms of pumping the brakes on inflation. Third, in the Inflation Reduction Act, there was a very substantial focus on reducing healthcare costs, seeing premiums go down for millions of Americans, reducing drug prices, particularly for seniors, for those who are on Medicare, capping out-of-pocket expenses at $2,000 per year, allowing for the first time Medicare to use its kind of bulk purchasing power to negotiate for lower prices. That's a game changer for seniors, and that's going to really help people in terms of their bottom line. So that is passed into law as well. We were talking before the show started about all of these things that have passed that maybe not everybody knows about. But I think those are important steps forward. There's other things I think that need to happen. One of the areas where we've seen substantial inflation is with regard to housing. We have a housing shortage in this country, and we certainly have a shortage of affordable housing. And so one of the things I serve on the Appropriations Committee, which is tasked with figuring out where the dollars get spent. One of my areas of focus on that committee is making sure that there's adequate resources to invest in affordable housing.
Thank you so much.
You bet. I know these are long answers, but they're complicated questions.
Absolutely.
So, yeah.
I appreciate it.
Well, thank you, Anaid, and thank you, Congressman Kilmer. Now is the turn for Maru. Maru, we have Maru from La Resistencia via StreamYard. And Maru, welcome. Can you hear okay?
Yes, I can hear you well.
Perfect.
Thank you.
Okay.
I hope it's not too echoey here. So thank you for the invitation. Thank you for the space. And I'll be doing my questions and translating into Spanish and allowing for the Congressman to reply. Basically, Congressman Kilmer, we here in Washington State have fought really hard to keep and expand protections for our immigrant communities. We have done a lot of work to protect our immigrant communities from the racist and xenophobic immigration enforcement through the Immigration and Customs Enforcement Agency, a federal agency. President Biden promised in his campaign trail that he would undo private detention. That has not happened. As a matter of fact, his administration not only not followed that, but his administration actually followed on a lawsuit by the Trump administration against California for a state law that they passed protecting them from private detention, same as we just did here last year with HB 1090. And the Biden administration decided to continue that lawsuit against California, saying it's unconstitutional. And also in the recent protection that the administration did for people that had marijuana possession charges, they excluded undocumented immigrants. So my question to you is, what can you do to work with our Washington State legislature, not to only protect what we have right now, but to expand those protections at a state level? And I'm going to interpret into Spanish.
Sure.
Entonces, mi pregunta es que la administración de Biden prometió cuando estaban en campaña que iban a eliminar la detención privada. No lo hicieron, no lo han hecho. De hecho, no, lo que sí hicieron fue continuar una demanda que puso la administración de Trump en contra del estado de California por una ley que pasaron para prohibir detenciones privadas como lo que tenemos acá en Washington con la ley HB 1090 a nivel estatal. Y aparte, recientemente pasaron una protección para gente que tuviera cargos por posesión de marihuana, pero excluyeron a nuestra comunidad indocumentada. Mi pregunta para él es, ¿qué piensa hacer él para apoyar los victorias que tenemos hasta ahorita? ¿Cómo trabajaría él con nuestra legislatura estatal para no nada más conservar estas protecciones, pero también expandir estas protecciones a nuestra comunidad inmigrante.
Thanks for the question, Maru. I think it's important to start with core values. You know, to me, one of our core values ought to be that all people should be treated with dignity and with humanity. And second, one of our values should be that immigration policy shouldn't be tied to a profit motive. And in that regard, I joined some of my colleagues in sending a letter to the Biden administration, to the Department of Homeland Security, calling on them to stop contracting with for-profit detention centers. I do not think that that our immigration policy should have for-profit motives tied to it. Second, there's a bill that I've sponsored that's called the Dignity for Detained Immigrants Act, that's led by Congresswoman Jayapal up in Seattle. It, among other things, would put an end to the use of private for-profit detention. It also establishes, minimum health and safety and well-being standards for any sort of immigrant detention. That exists within other components of the federal system that doesn't currently exist as it pertains to immigrant detention. And I think that's very concerning. Again, if you start from a values point of people should be treated with dignity. I mentioned I serve on the Appropriations Committee. In both this year's process and last year's process, we were able to include funding for alternatives to detention, which allow for things like community monitoring, and while people are in the process of waiting for the immigration court process, rather than being in a detention facility, being able to stay within a community setting. So those are some steps that we could take immediately. I'm hopeful that we can see that bill pass either through the appropriations process or as standalone legislation. And not only do I support it, I'm a sponsor of it.
Thank you. I mentioned several things that we know already that being tried still hasn't happened. But for us, as you mentioned, conditions, there's a need right now, there's an emergency on how things are being done at the detention center, being a private detention center. Geo Corporation that owns and runs this detention center continues putting an emphasis on money, not on human beings. And so right now, since things are getting worse and worse in the detention center, and actually the detention center will go into your district starting next year. That would be your jurisdiction. And like you said, there's no standards right now that are really set. So a corporation such as Geo is accountable. There's no real oversight. There's no transparency. What can you do now? While we have a federal legislation, possibly maybe next year, I don't know. It hasn't happened yet. But what can be done now? So there's actually real unannounced inspections. Mm-hmm. Even if the standards are low right now, is there anything that your office can do so there's unannounced inspections instead of the announced inspections that we have right now, in real transparency and oversight of this corporation that it doesn't exist so far? Entonces mi pregunta es que sí, como él mencionó, pues hay muchas cosas que se han intentado, pero no se han logrado, no han pasado. Entonces él también habló de condiciones y es verdad, los estándares de condiciones ahorita son bajísimos, pero tampoco hay ningún acceso a transparencia, no hay información. Entonces, ¿qué puede hacer la oficina de él con respecto a la corporación de Geo, que son los dueños del lugar y manejan el lugar? Para que realmente haya inspecciones que no sean anunciadas, porque las inspecciones que existen ahorita, pues les avisan con tiempo. Entonces, ¿qué puede él hacer ahorita? No esperar a ver si pasa una ley el próximo año o quién sabe cuándo. ¿Qué se puede hacer hoy día para que exista realmente una inspección de esos lugares, aunque los estándares sean bajos, para que haya verdadera transparencia de lo que está ocurriendo en el centro de detención, ya que las condiciones son tan terribles?
I agree with the importance of allowing unannounced inspection, unannounced visits by members of Congress. And I say that in part because I think it's important from a standpoint of accountability and transparency when it comes to meeting those minimum standards of health and safety and well-being. That's part of our job as members of Congress, to conduct oversight over the executive branch and any entity with whom the executive branch contracts as well. And so that is something that I have voted for already, that was included as part of the appropriations process previously. And I think it's important for the legislative branch to sort of exercise that authority. For what it's worth, the bill that I just mentioned, the Dignity for Detained Immigrants Act, actually includes penalties for failure to meet those basic minimum standards. I think that's important because it puts some teeth behind if one of the detention centers is not living up to its part of the bargain. It would hold those companies legally liable. And it comes with penalties for failure to treat people with dignity and to ensure health and safety and well-being. I think that makes sense. That makes sense too. I guess the final thing I'll mention, I actually just visited the detention center here in Tacoma. I went with Congressman Smith and with staff from our 2 Senate offices. It was not an unannounced visit, but we were given the opportunity to, in part, it wasn't unannounced because we had to coordinate schedules across 4 congressional offices. But we were able to, without exception, ask to see the medical facilities, asked to see the kitchen facilities, asked to see some of the older detention units, asked to see pretty much whatever we wanted to see while we were there. There were some questions that we had that sort of got punted to, where they would say, we don't really know the answer to that question, but here's who you can ask. So we've got a long list of follow-up questions following that visit. But, I look at that part of my job of conducting oversight as really important, and certainly showing up and putting eyes on those issues and making sure that we're holding them to account, I think, is very important.
Well, thank you. Muchas gracias. And I'm sorry I have to leave because my phone is dying.
All right. Thank you.
Disculpen que pero mi teléfono está a punto de morir. So thank you again.
Gracias, Maru. All right. Well, thank you, Congressman Derek, for the answers. And well, let's continue. And I'm going to just take a moment to read the questions from Dr. Leon. Of course, he is concerned on what's going on in the medical field, right? Such an important part of our society, right? To be healthy. So here comes the questions I have from Dr. Leon. And so, is this administration taking the necessary steps to face a future pandemic? Esta administración, ¿verdad? Desde su punto de vista, Congressman, haciendo lo necesario para encarar pues una futura pandemia, ¿verdad? En base a lo que hemos aprendido a COVID. Esa sería, that would be the first question for you, Congressman.
Well, I'll start with the good news. We have an administration that is taking the pandemic seriously, that is trying to follow the science. That is a bit different than the last administration, where the president was encouraging people to inject Lysol. Simply following the science is one positive step forward. You've also seen under this administration very significant investments in public health infrastructure and in global health systems so that we can do a better job of detecting and preventing and responding to emerging threats. On that front, the Biden administration has actually proposed elevating one of the offices under the Department of Health and Human Services that's focused specifically on disaster response and putting it at the same level as the Centers for Disease Control and the Food and Drug Administration, basically making pandemic response one of the core sort of functions within that agency so that it has the attention and the resources that it needs to avoid those sorts of threats going forward. I will add a little bit more good news, and that is that you've seen Congress by and large over the course of this pandemic make investments in everything from testing to vaccine distribution, trying to combat this pandemic leveraging the Defense Production Act for personal protective equipment. All of those things you've seen, by and large, support from Democrats and Republicans for. Now, here's the bad news. The Biden administration has said that it needs additional resources to combat future pandemics. Unfortunately, so far, Mitch McConnell and Senate Republicans have blocked any effort to provide those funds. And unfortunately, in the Senate, it takes 60 votes to pass something. I'm hopeful that this will be resolved as Congress hopefully passes a spending bill here at the end of the year. But the administration has said that they need additional resources toward this. That the fault will lie with Mitch McConnell and Senate Republicans if these resources aren't provided.
Okay. Thank you. Y pues como dijimos al principio, queridísima audiencia, aquellos que están practicando todavía su inglés y que hay algunas palabras que de repente se les van, no se preocupen, vamos a tener esta entrevista con estas respuestas de parte de nuestro representante Kilmer con una voz en español que sean interpretadas lo mejor posible para que ustedes también puedan entender muy bien lo que nos está contestando. Así que muchas gracias por su paciencia. Y the next question is there a plan to help with medical coverage to those that are still out due to the changes to the medical system in the previous administration? ¿Hay algún plan, algo en el que sus colegas, usted esté trabajando para pues cubrir médicamente, ¿verdad? Para que las personas que han quedado desprotegidas tengan acceso a cuidado médico de calidad? Go ahead.
There's been a fundamental difference between this administration and the last administration when it comes to healthcare policy. As you may recall, under the Trump administration, they were actively trying to repeal the Affordable Care Act. They were suing to get rid of the Affordable Care Act. It was a priority for them in Congress. I mean, I had to vote when I was in the minority in Congress over 50 times on the repeal of the Affordable Care Act. And it's important to point out that the Affordable Care Act, I wasn't in Congress when it passed. I don't think it's a perfect law, but it made a heck of a lot of progress for the people that I represent. It means millions more people have health care. It means that illnesses above the neck get treated the same as illnesses below the neck under insurance, so-called mental health parity. It means that preventive care like mammograms and cancer screenings and annual physicals are now provided without copay. It means that young people can stay on their parents' insurance until their 26th birthday. And so anytime you hear anybody say, well, we should get rid of the Affordable Care Act, that's a pretty lengthy list of things that we'd be getting rid of if they were successful in getting rid of the Affordable Care Act. Now, thankfully, you have an administration that not only doesn't want to get rid of the Affordable Care Act, it wants to build on the success of the Affordable Care Act. So what does that mean? That meant that under the American Rescue Plan and then recently under the Inflation Reduction Act, you saw premiums go down for literally millions and millions of Americans. That is good news. That is a big deal. Extending those premium supports under the Affordable Care Act means that more people can have health care. So that's a big deal. You also saw for the first time, and we talked about this when we talked about inflation, for the first time, Medicare is able to negotiate for lower prescription drug prices. Seniors will see their prescription costs capped at no more than $2,000 per year. People who are diabetic will see their insulin costs capped at $35 a month. That is tremendous progress in terms of trying to meet some of the challenges that the doctor's asking about. I think more needs to be done. I think in the greatest country on the planet, you shouldn't go broke when you get sick, and you shouldn't get sick because you're broke. And so there's more that needs to be done. But I think what we've seen so far out of the Biden administration and out of a Democratic Congress represents some progress.
Okay. Thank you so much. And I think you answered part of the last question from Dr. Leon with on this second one, but I'm going to do it in case you want to add something else. But I think it'll be okay. Basically, you told us what your colleagues and you are working on and what you're seeing as the challenges, but what can voters do in order to help with those challenges that you just mentioned?
Yeah, well, listen, the reality is there are real choices this November, right? You've got one party that has said it will make it a priority to repeal the Affordable Care Act, and you have another party that's actually trying to build on the success of the Affordable Care Act. I know that the doctor had questions around other things that need to happen in the health policy space. I'll give you another big example. We hear enormous concerns related to mental health and substance abuse. For the first time, you saw under President Biden and under a Democratic Congress, the passage of a law called the Safer Communities Act that provides additional resources to communities to address mental health challenges, to address issues related to substance abuse, to provide resources to schools and to colleges and universities, to provide more resources in addressing mental health challenges, which is important both from the standpoint of mental health and trying to address the epidemic of gun violence that we've seen in our country. That was a bill that every Democrat voted for and nearly every Republican voted against. And, so these are basically the choices that we make. And there are some stark differences between the two parties when it comes to addressing some of these just basic public health matters.
Okay. Well, thank you so much. And I want to also thank Dr. Leon for his dedication to this community. He volunteered many hours last year and this year to make with us a program, a radio show. It's called Una Pregunta Doctores, Question Doctors, which is a radio show that opens to basically anybody that wants to ask a question, especially those ones that don't see the doctors very often because they don't have medical insurance. So thank you so much, Dr. Leon, and thank you, Congressman, for the answers. And now is the turn, and wow, we are 2 minutes before 3 o'clock. So Jasmine, you're going to have 15 minutes, 15 minutes to ask. Yeah,
I promise I won't filibuster.
No, I'm hearing all the questions, and I don't want to sound redundant because, but at the same time, I was telling Congress Kilmer that we don't hear a lot of the good things that this President Biden, and the Democrats has done in such a short period of time. And we need to highlight that more to people, because when I talk to people about voting, they just hear just the bad things, and you have to bring them to see all the good things that in this short time. So I'm gonna go a little bit rogue here because most of the questions that I have, you already answer them, but I'm going to go first with the military families, because I know that you have worked very hard with the military families and the veterans. And I know that there is a high level of mental health happening in the community, military community, and veterans too. Suicide is very high and common in the military. So I would like to know your experience working with the military families and when it comes to mental health.
Yeah. I still remember my first year in this job going out to Joint Base Lewis McChord, and I met with the military leadership out there, and I said, "What keeps you up at night?" Thinking they were going to say terrorists or foreign adversaries or budget cuts, or I'm not sure what they were going to say, but I was surprised when they answered mental health. I had General Brown was the person we met with, and he said, I've lost more service members to suicide than I have to enemy combatants. And that, addressing military health care, addressing military mental health care for service members, for veterans, and for their families was a priority for me before that, but it's become an even greater priority in terms of making sure that we have the resources here in our region. In fact, earlier this year, President Biden signed a law that I was one of the co-sponsors of to expand some of the mental health services provided through the military, also to expand some of the care period here in Pierce County, which is good news. Earlier in my tenure, I was able to get a new community clinic built in Kitsap County to help our veterans. Prior to that, it was in essence, a very substandard facility. I mean, they literally had like mold on the walls and things like that. And we got a great new facility in Silverdale that's able to meet primary care needs, mental health needs, in a much more dignified setting. And I think that's really important too. As we look at the challenges facing veterans, healthcare is one big one. And it's a big one as we look at the aging population of veterans as well. I'm a sponsor of a bill that is called the Planning for Aging Veterans Act that's bipartisan, and it's focused on trying to address not just mental health needs among aging veterans, but overall health needs of our aging veterans, to get more resources for our state veterans homes, to look more at geriatric care, including mental health care. Beyond that, I sort of come at this from the standpoint of kind of core values, right? I just think if you serve our country, we ought to have your back, right? It means that you should get the benefits that you've earned. It means that, in the land of the free and the home of the brave, every brave service member should have a home, and it shouldn't be under a freeway overpass. And so a lot of what I work on is related to housing and making sure that we're expanding access to housing for our service members and for our veterans. And then finally, I work a lot on veterans employment issues as well. Again, I think if you fought for your country overseas, you shouldn't have to fight for a job when you come home. And so working on those issues related to transition into the civilian workforce has been a big priority for me too.
Okay. Thank you. And quiero disculparme porque no hice la pregunta en español. Y mi pregunta era que como él ha trabajado bastante en la comunidad militares aquí en el estado de Washington, y el impacto cómo lo ha impactado la comunidad en cuanto a lo que quiere decir la salud mental, que ha habido un alto porcentaje de suicidios en la comunidad militar. Y entonces esa fue la respuesta que él estaba contestando cuando, así que me tengo que acordar de hacer la pregunta. Have to remember to do the question in Spanish.
I jumped in.
No, but
Can I mention one more thing on the veterans front?
Yes.
Because your preface was, I think, appropriate in that you said, oftentimes President Biden and Democrats in Congress haven't gotten the credit for doing some stuff where the public doesn't know about it. So let me give you one other example. A bill that was passed into law called the Honoring Our Pact Act. That was a bill dealing with something that affects a whole lot of people in the district I represent, and that is military veterans who while they were in the service were exposed to toxic substances, burn pits. I think all of us have probably dealt with folks who served in the Middle East who were exposed to burn pits, who developed medical conditions as a consequence of that toxic exposure, and then insult on top of injury, didn't get care through the Veterans Administration for that toxic exposure. We've passed this new law that creates that in essence creates a requirement that the Veterans Administration cover medical conditions that are the result of toxic exposure. And it creates a presumption if you've developed a serious medical condition, and it lists a whole bunch of medical conditions that you may get because of toxic exposure. It creates a presumption that if you developed that condition, it was because of that toxic exposure. That's going to help. I cannot tell you how many people that I've talked to in the region I represent who have developed medical conditions because they were exposed to toxic substances and then just got completely roped around by the federal government. That's going to change now. And it's going to change because, unfortunately, with very little help from Republicans, most of whom voted no. The vast majority of Republicans in the House and in the Senate voted against that bill. But I think this is going to be a big deal for a whole lot of the people I represent. And it only happened because we had Democratic leadership in the Congress and a president who was willing to sign it.
Thank you, Congress. And I have two questions in one question.
All right.
The first question is the Build Back Better.
Yeah.
Tell us a little bit about it and what is its cover, because I know part of it, the chips. And what else? And I was telling Christian and I was telling you too, I want to make more emphasis on the good things that President Biden and the Democrats has done.
Yeah. If you look at the president's Build Back Better agenda, it basically got pulled into 3 bills. One was the American Rescue Plan, which was early in his administration, and it was designed to basically combat the pandemic. If you think about where we were in January of 2021, the headlines in the paper were really bad, right? At that point, nobody had been vaccinated. Our kids were still in virtual school, which as a parent, I can tell you was not fun. There were real concerns that we were going to go into depression because our Main Street employers were getting hammered. You were dealing with challenges where our hospitals were stretched to the brink. Our food banks were stretched to the brink. We were facing record housing insecurity. And so Congress passed the American Rescue Plan and President Biden signed it. And the consequences, we got now more than 220 million Americans are now vaccinated. Our kids are back in school in person, which again, as a parent, very grateful for that. We had the Paycheck Protection Program, which provided a real lifeline to our local employers. There was assistance to our food banks and to address housing insecurity and food insecurity. That's not to say that everything was perfect in our economy or is currently perfect in our economy, but that American Rescue Plan made a big difference. Second, you mentioned the CHIPS and Science Act. That was to address some of these supply chain issues. So even as we sort of quote unquote go back to normal, it's a new normal, right? It's a better normal where we're building things in America where we aren't dependent on Taiwan or South Korea or China or any place else for semiconductors or for anything else, so that we can actually build things here in America and lower costs for the American people. And as I mentioned, that bill also included a bill that I was the lead sponsor of, focusing on helping communities that have faced persistent economic distress. And then the third piece of the president's Build Back Better agenda was the Inflation Reduction Act, which was focused really on 2 things. One, reducing healthcare costs. And I think I talked in detail about what that bill dealt with. And the second was combating the climate crisis and lowering energy costs. And these are really significant bills, and again, focused on recognizing that we can't just go back to normal, that there needs to be a new normal. There are things I wish would have been in those bills and that we still need to work on, right? Like, I believe that we should have paid family leave and paid sick leave in this country because people shouldn't have to choose between their health and their paycheck, or the health of a loved one and their paycheck. I think we need to raise the federal minimum wage. I think we should address some of the challenges that we faced within our immigration system. There are other things that we've got housing challenges that you and I talked about before we even went on the air. All of these are components that I would, the child tax credit, expanding that and lowering child poverty in our country is really important. But let's not understate how important some of the progress that's been made is to our economy and to the people of this country.
Thank you. I forgot the question in Spanish again. Y mi pregunta era la póliza de el Big Back Better. Y parte de eso ya lo había explicado en cuanto a la economía y todo lo que incluye esta póliza. Y mi tercera pregunta, que va a ser cortita, va a ser ¿por qué en estos momentos es más importante que nunca los que podemos participar en este proceso de votar? En estos momentos es bien importante en este término medio para este país y para el futuro de la democracia de este país. So my question is, why? I'm worried. I am very worried. I've seen the trajectory of this country and seeing the 2 big parties, how opposite is directions you're going. And my question was, why today? Because every election, they said, this is the one that is important. And why you think it is so important today, especially for this mid-election, for people to go out and vote, for the Latinos that are able to vote, to go out and participate, especially when it comes to women here in this country, when it comes to the transgender, to the LGBT community, when it comes to the a community, African American community, when it comes to the immigration, what would you tell people why today is imminent? Because I'm worried. I can see the signs. I can see, as being an Afro-Latina woman, I can see the signs and the shifting of where is we don't fight, it's not going to be pretty to live in this country.
Well, I appreciate the question. And I think the reality is there are real differences between the two parties. You know, you said you're worried. We have a motto on our team. We say, don't agonize, organize, right? That I'm not a hand wringer. But I do think it's worth laying out some of the differences. And we talked about some of them already. You have one party in the Republicans, and certainly you saw this under Donald Trump, where they were actively trying to take health care away from people. You have President Biden and Democrats in Congress working to build on the success of the Affordable Care Act, lower the cost of health care for people, make sure more people have insurance coverage, and make sure that you don't go broke if you get sick. That is a difference between the two parties. You know, you have on issues related to immigration under President Trump, he had two policies: build a wall and separate immigrant women from their children at the southern border. That was his immigration policy. And I think you've seen a difference in the Biden administration's approach. And personally, I am supportive of having a comprehensive immigration reform bill that addresses all of the challenges that we face with our legal immigration system so that we modernize it. And I say that as the son of an immigrant. My mom and grandparents came here in 1948 on a boat. So that is a difference between the two parties. You know, on issues related to the economy, you saw, you know, with regard to tax policy under President Trump and a Republican Congress, their main agenda was giving a tax cut to very wealthy people and to corporations. Under Democrats and President Biden, the focus was on helping those Main Street employers through things like the Paycheck Protection Program, expanding the child tax credit, which when we did that under the American Rescue Plan, it reduced child poverty by 40% in this country, by 40%. You know, so the focus was not on the wealthiest 1% and on big corporations. It was on people in our community. You know, I don't represent a bunch of people who live in the 1%. I represent folks who are just trying to make ends meet. And so the things like the Inflation Reduction Act, things like the American Rescue Plan were really targeted at trying to help people who are just trying to make ends meet. That is a fundamental difference between the two parties. And finally, I think, you know, to some degree, democracy is on the ballot this year. You know, I was in the Capitol. I was actually locked in my office with furniture against my door on the 6th of January of last year. And I saw how fragile this democracy is. You know, you've got a situation where you've got one party that won't even say that Joe Biden won the election, that is actively trying to create barriers to voting, not just for the Latino community, but in communities of color broadly, opposing a new Voting Rights Act to protect the right to vote. And you have another party, Democrats, who are actively trying to protect voting rights and remove barriers to voting, and standing up for democracy and standing up for the people's voice in our democracy. Including things like campaign finance reform to reduce the role of big money in our political system. Those are fundamental differences between the two parties. And so I think sometimes people will look at our political system or watch cable news and say, gosh, well, does it matter? And I hope as you hear some of those differences between the two parties, I hope you recognize it really does matter, because this dictates what direction our country takes. Do you want a future where people have more rights and more freedom, or less rights? Do you want to have a future where regular folks just in our communities have more prosperity or less? You know, do you want our families to be more safe or less? And this is why I'm a Democrat and why I'm hopeful that we will have success in November.
Thank you, Congressman Kilmer. Thank you.
Well, thank you everybody for joining us at this interview. Thank you, Congressman Kilmer, for making the time to come and have this conversation with us. We're not the only radio station for the Latinx community, but we are probably the first one or the only one in Tacoma. So, yes, and Jasmine, Thank you so much for your very good questions. Thank you also, Professor Anaid, for also the questions you had at the beginning, for making the time to come to the studio. And Maru, it's gone, but we'll send them a note that very, very good questions that she made. And also, very good job to your staff, your office, Congressman Kilmer. Thank you so much for your staff, Courtney, for helping us to make this possible. And so have a good day, everybody. And remember, we're going to be repeating this interview in Spanish in a few days. A todos aquellos que nos siguieron tratando de pues mantener el paso de nuestra conversación en inglés, no se preocupen, vamos a tener esta misma entrevista, pero con voz en español totalmente. Así que muchas gracias, muy buena tarde a todos y hasta la próxima. Gracias. Thank you.
Bye.